Good afternoon to my family, my friends, my community. I wanted to hop on to share some words about the coronavirus as people are concerned for very good reason, but possibly more important than the illness, is that it's forcing us to connect with ourselves, to boost our immune system. I find that there's been a lot of disconnection, and that can lead to panic. This social distance is forcing us, of course, by the virus, but I believe it's also a good thing. We don't want to, of course, spread it, but it's also an amazing time right now to connect with ourselves. And I find as a doctor, the more that you are connected to yourselves, that you know how your body is, the better. Often people speak about the mind-body connection. There is some research that got released recently. In fact, there is no mind-body connection. It's one unit. It's actually the same thing. So whatever your thoughts are, your cells are eavesdropping, literally. Mind your mind, mind your thoughts. You have energetic sovereignty if you choose to accept it. In Chinese medicine, fear is associated with the winter, the water element. And along that continuum of fear is wisdom. It's where legacy comes in, the very core of your essence and the truth about who you are. So the fastest way to change your body state, your thoughts, your emotional state is breath, is to slow down, find stillness, and remember universal truths. That's why I love to practice Qigong. I'll be doing a Qigong series for the lungs and the respiratory system and the immune system next Friday out here in Santa Cruz. I'll see if I can record it for people that are not local. But, one thing about the virus, it doesn't care about your race, your gender, your sexuality, how much money you have. If you actually look at the coronavirus under a microscope, it has the little tentacles. It's about grabbing, dredging up, pulling up to the surface. Spiritually, emotionally, we can look at it, what needs to be healed. We can't stuff, ignore, look at the other way at this point. So what does need to be revealed and healed? And in fact, health is my number one value, and it should be for all of us. None of us are immune to the virus. So it's a great time to just upgrade, to up level our health in all levels, to take really good radical self-care. Like many healthcare providers, I've been following the daily United States Center for Disease Control and Prevention, the CDC, updates about the recent coronavirus outbreak. I want to be up to date, what to look for, what symptoms. We're looking at 2 to 14 days after exposure. We're looking at fever, cough, shortness of breath. So if you develop emergency warning signs for COVID-19, you do want to get medical attention immediately. So emergency warning signs include difficult breathing or shortness of breath, persistent pain or pressure in the chest, new confusion, or an inability to arouse, and sometimes we have a bluish lips or face. So that list is not inclusive. It's important to consult your own medical provider for any symptoms that seem severe or concerning, that you don't necessarily have. It's important to know how it spreads. So most of us have been on social media and looking at the news. So person to person. This virus is spread mainly from person to person. So between you and someone else about 6 feet away, and it's through what we call respiratory droplets. They're produced when an infected person coughs or sneezes. So these droplets can land in the mouths or noses of people in a nearby area, or possibly inhaled into the lungs. So that's why if you do feel like you're infected or you do have a cough, those are the ones who should be wearing the masks. If you don't feel like you're infected, you actually do not want to wear a mask. So can someone spread the virus without being sick? Well, people are thought to be most contagious when they are most symptomatic, so the sickest. So know that. Some spread might be possible before people show symptoms. There have been reports of this occurring with the new coronavirus, but this is not to be thought to be the main way the virus spreads. Okay, so that's also important to know. We want to make sure that we know if we should go to the ER. So we want to keep the beds open for people that really need the beds. That's a problem they had in Italy. So as a reminder, it can spread on surfaces that might be contaminated. So if a person that has COVID-19, if they touch a surface or an object that has the virus on it, and then they touch their mouth or nose, possibly their eyes, this is thought to be the main way the virus spreads. So this is why we're seeing what? Don't touch your face, your nose, your eyes. You're always going to be wanting to wash your hands, especially being out in public. So, the virus easily spreads from person to person. So surfaces in the air within 6 feet. This is why, some spread easily, like measles, and some viruses don't spread easily. Another factor is whether the spread is being continuously spread. This is why I'm not recommending inside like gyms, all the surfaces. So there's currently no vaccine to prevent the coronavirus. Okay, the best way to prevent the illness is being not exposed to the virus. Okay, I would suggest being outside is a really amazing time. I'll talk about that in the future. But again, social distancing is about 6 feet. You really don't want to be in contact with anyone. This is why we're seeing all these events, schools closing, because people do not know if they're carriers, and they are infecting other people. And there is a social responsibility, a personal responsibility, that if you feel like you're not doing well, it's not to be embarrassed about. It's just about to take personal care, personal responsibility, so you do not affect others. So washing your hands often with soap and hot water for at least 20 seconds after you've been in a public place, after blowing your nose, after coughing, after sneezing. If soap and water are not readily available, we are recommending hand sanitizer that contains at least 60% alcohol. We're recommending to cover all the surfaces of your hands and rub them together until they feel dry. Again, avoiding touching with your eyes, nose, and mouth, and any sort of unwashed hands. And, of course, a lot of us wanting to use essential oils and herbal alternatives, and just make sure that you know what you're doing if you're making the DIY recipes. We do want to avoid contact with people that are sick. We do want to put distance between ourselves with other people if this virus is spreading in your community. And then again, this is especially important for people that are at high risk of getting sick. So, we do want to take steps to protect others. So please stay home if you're not feeling well. Stay home if you are sick, except to obviously get medical care, and learn what to do if you're not feeling well. I can't stress enough, there's no shame in it. If you are coughing, cover your cough and sneezes. We say cover your mouth or nose with a tissue. And also, you can do it inside your elbow. And it is kind of common sense, but you do want to throw used tissues in the trash. We don't want to be throwing them on the floor. And again, getting up and immediately washing your hands with soap and water for 20 seconds. And like I said before, if soap and water is not available, you really do want to have hand sanitizer around at all times. So real basic stuff, but these are things that keep a global society well. And we want to just know that everybody's doing the right thing, and if you're wearing a face mask, if you're sick, if you're not sick, then don't. That's pretty basic. If you're sharing a room or sharing a vehicle, before you enter a healthcare provider's office, it's important to be wearing a face mask if you're not feeling well. And again, I would say, do your best to always cover your coughs and sneezes. And again, if you're a caretaker, if you're living with someone that is elderly, that is important to know what to do if you are sick. But if you're not sick, you do not need to wear a face mask unless you are caring again for someone who is sick, and they are not able to wear a face mask. Face masks, they're short supply, just like toilet paper in my town. So face masks really, the masks should be saved for caregivers. We're finding that a lot of people can't even get basic access to things because other people are in panic and they're buying out things. I have gone through and disinfected surfaces daily: tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets. I use soap and water. You can use other things to disinfect them, but it's one of those things where we're out in public during the day and it's nice to just clean it up. It's not surprising that I'm hearing on Facebook and from patients, they're having anxiety, fear, panic. Patients and friends have asked me what to do, how to be prepared when the inevitable, unpredictable, uncontainable coronavirus reaches our side of town or our community. Aside from recommending hand washing and avoiding crowds, crowds, the answer might be surprising. I'm a practicing Taoist. I practice Chinese medicine. I teach outdoor fitness, outdoor boot camp, and outdoor Qigong. I love nature, and being outside is one of the best things that you can do to continue to have movement, to connect with nature, to connect with yourselves, get fresh air, clean out the lungs. In Chinese medicine, the little dew droplets is the best qi. So the best thing you can do is improve your immune system. Those to defend against any sort of daily insults like bacteria, fungus, viruses. In the nutshell, do what you do in your daily life to determine, the effectiveness of either it's going to increase your immune system or it's going to weaken your immune system. It's really that simple. We know that sugar and alcohol, stress can weaken the immune system. We know that breathing, fresh green juices, there's adaptogens, herbal medicine, tinctures that can boost it. So I want to go into what can you do to strengthen your immune system. So first of all, sleep, physical exercise, reduce stress, eat lots of vegetables, avoid any sort of toxic insults like alcohol, tobacco, parabens, phthalates, plastics. Most of all, again, outside is a cleansing tonic, or stay inside. Look at one of my recent posts. I posted a small machine that you can buy. It zaps everything in the air and on surfaces. It's amazing technology made here right in the United States. It's called HypoAir. There's a link there for you. Go ahead and read all about it. So if you are indoors, you might want to invest a few $100s in having way more than an air filter. And again, it's pretty amazing. So a couple more things before I get into very specifics. So if from Stanford, they're saying, if you have a runny nose, if you have some phlegm, if you have basically you probably have a common cold. The coronavirus, so pneumonia is a dry cough with runny nose. The new virus is not heat resistant. So they're saying that this virus can be killed by a temperature of just 26 to 27 degrees and it hates the sun. So if someone sneezes with it, it takes about, they're saying 10 feet before it drops to the ground and is no longer airborne. So that's interesting. So they're saying that it doesn't like moist. So if it drops on a metal surface, it's going to be alive for at least 12 hours. So if you do come in contact with any metal surface, you do want to wash your hands as soon as you can with the bacterial soap. That's important to know. But on fabric, it can survive 6 to 12 hours. Normal laundry detergent will kill it. So again, I'm trying to do laundry. I'm actually cleaning out my towel in the kitchen every day. But again, drinking warm water is effective to kill viruses. So try not to drink liquids with ice. Again, I talked about washing the hands. The virus can only live on your hands for about 5 to 10 minutes. A lot can happen in that time. Usually we're going to touch our face in 5 to 10 minutes. So that's why we're saying that. Another thing I had said to some patients recently is gargle with some salt water. So warm water with some salt. And again, I can't emphasize drinking plenty of water. You're wanting to keep the mucous membranes damp. Making sure that, every 15 minutes take a couple sips of water. That can go a long way. So what happens? Well, if you do think you're going to get it, it's going to affect your throat. So you're going to have a sore throat. It might last 3 to 4 days. Then the virus is going to blend into a nasal fluid that enters the trachea. It's going to then enter the lungs, maybe causing what looks like pneumonia. It's going to last about 5 or 6 days further. With the pneumonia comes a high fever and difficult breathing. The nasal congestion is not like any normal kind. So you feel like you're kind of drowning. It's imperative that at this point you seek immediate attention. Okay, so this is very different than what you would feel normally with a common cold. And most of us have had a common cold, so you could probably differentiate. So in Japan, there were some doctors, and this is what they're saying. Keep your throat moist. Like I said, take a few sips of water every 15 minutes. Even if the virus gets into your mouth, drinking water, other warm liquids will wash the virus down through your throat and into the stomach. And once it's in your stomach, the stomach acid will actually kill the virus. Okay? So what are you going to do? You're going to drink water, a few sips of water every 15 minutes. Warm water, gargle with salt water, really making sure you're keeping the fluids going. Okay? If you don't drink enough water more regularly, the virus can enter the windpipe enter the lungs, and that obviously can be very dangerous. So the new coronavirus may not show sign of infection for days. So how can you know if you are infected? Okay, so then again, this is from Japan. By the time that you have a high fever and or cough and you go to the hospital, the lung is usually 50% fibrosis. And fibrosis is not, I want to say reversible. I believe that everything is reversible, but it's good to be cautious. And this is just what they have seen in the trajectory of it. Taiwan, came up with this thing that you can do. It's going around the internet, and that you can do every morning. You can take a deep breath. You can hold it for more than 10 seconds. And if you complete it successfully without coughing or discomfort, stiffness, tightness, it proves that you do not have fibrosis in the lungs, and basically indicates that you don't have an infection. So at critical times, please check right now, every morning, with your environment. And I do stress clean air, and that's why I recommend the air filter. So again, the symptoms are going to be a little bit severe. So aside from all the unknowns about the coronavirus, one of the most worrisome things for the public are the reported similarities to the seasonal cold and flu. The truth is, in some cases, it can be difficult to tell which is mild cases of coronavirus and then which ones may go undetected. So I think it's important to have a relationship with your primary care physician, who you can check in with easily if you can, need help differentiating symptoms. But I thought maybe it would be a good idea if maybe we just went over the main ones. And so, most of us kind of know, but I think it would be nice to know the differentiation. So how symptoms of COVID-19 differ from the cold and flu. Coronaviruses are not new. So some coronaviruses cause things like, of course, the common cold, while other ones cause more infectious, like SARS that we've seen. I know this is probably a lot of information, and a lot of health organizations are following it. Many viral infections have stereotypical symptoms. So fever, mucus production, body aches, cough, shortness of breath, fatigue. And I find that, as a doctor looking at patients, I've even had to up-level my differentiation of signs and symptoms to really understand what I'm doing. So common colds come on gradually, and the most common symptoms are stuffy nose, sore throat, and sneezing. They sometimes also include cough and fatigue. Fever and headaches are rare with this. Okay, so that's the first thing to know. The second thing is I wanted to share. So again, notice that. But the seasonal flu. Okay, symptoms of the flu, they are abrupt. They include fever, chills, cough, sore throat, runny, stuffy nose, muscle, body aches, headaches, and fatigue. Some people might have vomiting and diarrhea, but though it's more common in children. Okay, so that is, the seasonal flu is very different. And, again, comes on a little bit faster, and symptoms are more severe. I've been obviously in contact with Chinese doctors, being a Chinese doctor, and the illnesses were fever and cough. Shortness of breath is a hallmark symptom. In China, they found that a very small percentage of patients experienced nausea, vomiting, and diarrhea, but again, very small percentage. And in China, they were successfully, after being able to get direct emails from some of the Chinese doctors, they were successfully, from beginning to end, treat patients with Chinese medicine. So patients with coronavirus feel like it's the worst cold or flu-like illnesses they've ever had. Immunocompromised individuals are more at risk for developing a severe version of COVID-19, okay? And if you have this. They may not be able to have, drum up a strong enough immune response. And then, of course, there's been dire outcomes to massive inflammation and tissue damage triggered by the virus. And it hasn't been good for people that, again, have already been immune compromised before they'd gotten exposed to the virus. So your body's reaction to a virus, if we want to get technical, some of us want to, because it lets our mind, our ego, to rest. But when the lungs, when the immune system reacts to a virus, there's a viral replication, there's an immune hyperactivity, there's lung tissue destruction. Not all people infected with the virus will experience all three of those phases, but this is what happens when we get exposed. Your body is built to fight. because it wants to be upright. It wants to be functioning. But what's going to happen is your body's going to produce mucus in an attempt to contain or trap the virus. Okay, this virus tends to negatively affect our lung system, the hair cells that tend to move the debris, move the mucus, move the infectious agents out of the body, right? So that's what's going to happen first. And so this is why I like to do the knocking and the breathe. But the second phase of the infection involves an overstimulation of your body's defense against the viral infection. Okay, so when the coronavirus is marked with an upswing of the production of what we call infection-fighting chemicals produced by your immune cells, they're called cytokines. So these cytokines in turn signal immune cells to enter the picture and try to engulf the virus, resulting in cell death and increased inflammation. Okay, so again, your body has this intelligence already built in, which is beautiful. So viruses with high replication rates, like the coronavirus, often overwhelm the immune responses, leading to local tissue destruction and depletion of those cells. So cytokines, okay? So they're going to travel via the circulatory system, they're going to go to the kidney, the liver, the small intestine, and dramatic increases in cytokines are referred to as a cytokine storm, and this appears to be the distinguishing feature of severe respiratory viruses versus lesser viruses like the common cold. So sometimes you may be a carrier of the virus but have no symptoms, meaning you can unsuspectingly pass it on. Okay? So again, thank God our bodies are brilliant and intelligent. This is why adding in sugar and stress and all the other things aren't going to help your bodies, fight our cells. So what do you do if you get sick? If you get sick with fever and cough and congestion, stay at home. Alert your primary care provider. They're going to help you, figure out what to do. And then if you haven't had your flu shot, your doctor might prescribe an antiviral for the flu, just as a precautionary measure. You decide if you're going to do it. If your symptoms tend to stabilize, meaning you continue to have cough, low-grade fever, and body aches, but no noticeable shortness of breath, stay home. Rest, support your immune system as it fights the viral illness. It's going to go along its course. Okay, so that's what's going to be important. There's a lot of things you can do for immune system. I'm going to go into that very specifically. So reports from hospitalized cases look at clinical deterioration around the second week of the illness. So patients, again, develop shortness of breath. It's a major indicator of respiratory compromise. So if your symptoms do worsen, particularly if you experience shortness of breath, it's imperative that you do go to the closest emergency room, take private transportation, or have someone drive you, call ahead, let the ER know of your condition. This is when you wear a mask. And again, this is if you do have the shortness of breath and you do get worse. But the most important thing is to notice the initial symptoms, call your primary care. Right now, can you get tested for coronavirus? Well, currently, diagnostic testing for COVID-19 is being performed at state public health labs and the CDC. I think it's changing every minute. The CDC has broadened their guidelines for the coronavirus testing so that anyone can be testing if they're symptomatic, if your doctor puts in an order. So that's important. So at this time, there are no protocols for in-home testing of suscepted cases of COVID-19. So know that. So the most important thing is to do is know your body, understand the signs and symptoms I've talked about, understanding the progression. Okay, so while testing will become more readily available, then yes, if you have first signs of a cold and should be tested for coronavirus, absolutely. Now you have to know that the number of tests will going to be limited at first because getting tested too early could divert the much needed tests from seriously ill people, and your doctor will determine if you should be tested. So things you can do on your own is going to be the most important thing for everybody, just to view us as a group, as a society, as one. Again, people that went to China, Iran, Italy, Japan, South Korea, or who had contact with someone who had recently traveled, those are the people that are susceptible. And so that's important to know who has been traveling, because again, it takes a while for them to show signs and symptoms. And I think that's why all of us are just saying social distancing. So if you do test positive, your doctor is going to decide a course of treatment based on the severity of your symptoms. If your condition is relatively stable, you may be able to stay at home. You'll need to strictly isolate yourself from other people in your home, and they will need to have access to appropriate recommended personal protective equipment. At a minimum, I would say gloves and an N95 face mask. That's going to be important. Again, we don't know what's going to happen over the next 1, 2, 3, 4 weeks. We really don't. And so this is why it's just good to have this conversation. Everyone will need to adhere to precautions recommended as part of home care or isolation, such as good hygiene. You'll also need access to food, other necessities. Critically ill patients will be placed probably in special single patient rooms that help prevent cross-contamination from room to room to the next. And when inside, the patient's face mask can be removed, of course, but all individuals entering a room will need to wear protective equipment masks. And again, even after symptoms resolve, I would say, I think the CDC is saying you have to have 2 negative tests to be released from quarantine. And that's probably how it's going to go. So one of my personal main concerns is when someone has something going on and they don't know it. So in Chinese medicine, or even in Western medicine, allopathic medicine, the heart and lungs are incredibly interconnected. So if you breathe in and out rapidly and your pulse automatically increases its pace, some of us may never know or might not know right now that we have a cardiovascular or respiratory issue. And if you get the coronavirus, it could be deadly to you. If your heart is already weak, if your heart has blocked arteries, and then you're working harder than a normal person to circulate blood and oxygen throughout your body, this is when you have a comorbidity. Cardiac stress is yet another arena where the coronavirus mirrors what happens when you get the flu. Influenza has been long established as a propellant for heart attacks and cardiovascular disease. So much so that some doctors have wondered if the seasonal virus is a direct cause. So, I'm more interested in the conversation of someone carrying it, before they're symptomatic. So, again, it takes up to 14 days, but then they affect someone that, has a lung or a heart issue. So they're saying 7 days of a flu diagnosis, 6 times are more apt to have a heart attack. There was a 2018 study. So again, these viruses can trigger a heart attack or stroke, and that's more of my concern. It's more than people not realizing if they have an issue. There was one other thing I was going to mention. You can be affected by more than one disease at a time. So again, exacerbating heart conditions. There was a preliminary study from Wuhan. 4% of the cases were infected with, again, the second virus, so the flu. So again, if your immune system is weakened or, you're caused, by a pathogen, you're more susceptible to get a secondary infection. I think that's my main concern. People have asked me, are you concerned about the coronavirus? There's an underlying pressure in matters of the heart. I think about my dad. People could be at risk with conditions, again, high blood pressure, hypertension. It can contribute to atherosclerosis. So atherosclerosis is when walls of a person's blood vessels grow dense plaques made of fat and tissue fibers. If one of these plaques erodes or ruptures, it can block the blood vessel, leading to a heart attack or stroke. A lot of people are walking around unaware with plaque, unaware with hypertension. Okay, so this is my concern. The CDC right now estimates that 108 million Americans have hypertension, but at least 11 million have no idea. It's the secondary issues that we don't know about. So that's why I think social distancing is so important. If I were to say anything, that would be it. So the threat of respiratory infections, where the flu, where the coronavirus comes in, these infections can create a blood storm, inflammation that courses throughout a body. Once the body's infected, what the coronavirus does. We're calling it fulminant myocarditis. It's an unusual syndrome that erodes the muscle in the heart. They did this study in Wuhan, and I'm just saying that a lot of us don't see our primary care every year for a lot of reasons, and people don't realize. So people that have no history of cardiovascular disease, some people that have a history of cardiovascular disease that might not know it, vice versa, atherosclerosis, diabetes, suppressed immune system. You are more vulnerable for infections. And if you get anything from this long, maybe too long discussion, I would say if you haven't been to your doctor and you don't know about some underlying issues that you have, that's the marker. So given the myth that we are in flu season and the coronavirus crisis, doctors are recommending cardiac patients and diabetic patients have enough of their regular medications, that everybody checks their blood pressure and make sure it's under control. Those are basics. So if you are in that category, please take care of yourself to make sure that nothing is happening that's alarming and it becomes an emergency in the next 2 to 4 weeks. I do want to have one last note before I get into details. Asthma. There are severe implications with people with chronic respiratory illnesses such as cystic fibrosis, chronic obstructive pulmonary disease, allergens, asthma, any lung damage linked to smoking. You are really susceptible to the coronavirus. And again, that's a sector of the population that it has a high risk. So even mild cases of the cold and flu can aggravate these conditions, increasing one's chance of landing in the hospital. Many members of the general public can be infected and contagious, yet again, have no awareness of their illness. Okay. Last thing I was going to say is a new study that was published Monday in the Lancet found that coronavirus patients shed the virus, an indicator of being contagious, for between 8 to 37 days. Okay, that was just published on Monday. So yes, they're saying 4 to 14 days, but yeah. So cleaning products I want to talk about first. Soap and water. Just the friction of scrubbing soap and water can break the coronavirus's protective envelope. So what you want to do is scrub like you got sticky stuff on the surface that you really need to get it off. Okay, that's the most important thing. People are talking about scrubbing in their nails with a scrubber. Kind of feel like just pretend you're a doctor. Discard the towel or leave it in a bowl of soapy water for a while to destroy the particles that may have survived. You can also, of course, use paper towels. I'm not one advocate for that. It seems a little bit wasteful, but that's okay. Whatever you feel that you want to do. The second cleaning product is bleach. So CDC, they recommend diluted solution, a bleach solution of 1/3 cup of bleach per 1 gallon of water, or 4 teaspoons of bleach per 1 cup of water for virus disinfection. So you want to wear gloves while using bleach, and you never mix it with anything except for water. The only exception is when you're doing laundry and with laundry detergent, but bleach works great against viruses. So just don't keep the solution longer than a few days, because bleach will degrade certain plastic containers. I'm sure you know this. Bleach can also corrode metal over time, so do not get in the habit of cleaning your faucets, stainless steel products with it. Bleach is harsh for many countertops, so you should really rinse the surfaces with water after disinfecting it, because you do want to prevent discoloration or damage to the surface, especially if you have nice countertops. So bleach is amazing. Okay, so those two, soap and water, and then bleach. The third thing that I was going to mention to you, again, just to make sure that we are disinfecting, is isopropyl alcohol. So alcohol solutions with at least 70% are effective against the coronavirus. Now, do not dilute the alcohol solution. Alcohol is generally safe for all surfaces. It can discolor some plastics, so you want to be mindful of that. And then the last one is hydrogen peroxide. So according to the CDC, 3% hydrogen peroxide is effective of deactivating the rhinovirus, which causes the common cold, which is 6 to 8 minutes of exposure. Okay, so this is amazing. Rhinovirus is more difficult to destroy than the coronavirus is. So hydrogen peroxide should be able to break down the coronavirus in less time than 4 to 6 minutes. What can you do? I like to pour it in a spray bottle, spray it on surfaces, have it be clean, let it be there for a few minutes. Again, don't dilute it. It's not corrosive, so it's okay to use on metal surfaces, but similar to bleach, I've seen it discolor fabrics. It can accidentally get on your clothes, which isn't great. But it is really good to get to use for hard to reach crevices. I like to pour it on the area so I don't have to wipe it off, because essentially it decomposes into oxygen and water, which is fine. And you can wipe it later, it'll evaporate. So those 4 things are ideal for in the home, in your cars, You can also be using cleaning your phones. We all know that the phones are disgusting. What can you do? Sleep. Number one, if you are not sleeping and you're not sure how to sleep or get deep sleep, please DM me. There are so many things you can do for sleep. I have herbal extracts. There's blue blockers. All that kind of stuff. Number two, working out. Gyms, no, nasty for bugs, nasty for touching gym equipment. Make sure you get outside. If you do go to the gym, then washing down all the equipment, of course, preventative measures are key, but moving your body. You need to move your body. Yoga, qigong, tai chi, walking. What's number three? Good food. Whole foods. Eat the rainbow. Vegetables, nutrient dense, whole plant foods. Okay? So you're going to want to reduce grocery shopping. So you're going to want to buy extra food. So again, this might be the one time I recommend getting some organic frozen vegetables. Broccoli, mixed veggies, sweet peas, spinach, etc. It might be nice to have some of this stuff in the freezer, but you can buy fresh vegetables, organic, now. Also frozen fruits, okay? So if you can buy fresh fruits and cut them and put them in the freezer. Not all fruit is going to last 7 days or more, but you're going to want to have some stock of frozen fruits. I like to have banana, mango, dark mixed berries, wild blueberries in the freezer. Again, you can make smoothies, protein drinks. You can make a lot of things for them. So things for, just to make sure on hand. Dry stocks of fruits, rice, legumes, lentils, chickpeas, black beans. You can now also have a couple extra cans of foods, chili, just as backup. I'd like to have a larger supply of nuts and seeds. These are great because they're so caloric dense. So if any reason we had less than the above foods of the fresh greens, we can at least get enough calories in and nutrients from them. So things like, I love Brazil nuts. I love cashews, almonds, walnuts, pumpkin seeds, sunflower seeds, hemp seeds. So again, putting them in glass jars, storing them. Just remember that good, healthy foods is going to drive up immune function. I love mushrooms, shiitake mushrooms. Again, cleaner the nutrition, the less inflammation, less free radicals. The less of those things, the less impaired your immune system is. So again, your immune system wants to upregulate so you can handle any sort of outside variable. So the cleaner you can eat right now, the better. Again, less sugar, less alcohol, less processed foods, less acidic foods, the better. Stay hydrated. Most of us recommend half your body weight in water and fluids. I recommend herbal teas, less sugar. So again, water. You can do warm water again. You can do teas, herbal teas, water. Did I tell you to drink water? Minimize stress. Okay. I'm recommending the Wim Hof method, take a hot shower, jump in the ocean. But reducing stress, you could do it with qigong, with breath work. Stress is going to weaken the immune set. So fear, anxiety, that's going to absolutely decrease the immune system. It's going to speed your heart rate up, and we get hyper alert. Our breathing increases, and we really feel like there's a perceived threat. And it's our fight or flight. It's our sympathetic nervous system that drive. And so we want to activate the parasympathetic nervous system. So again, mindfulness, not worrying so much. Okay. So I talked about mind-body connection. It's one thing. The mindset is going to be everything. Your body's going to follow it. Okay. So that mindset could be number one thing. Don't believe everything you think and feel. Don't believe everything you read. Absolutely not. And when you're feeling fear, anxiety, get into stillness, connect with your breath, and remember the truth about your immune system, your body. Stay off social media if you need to, okay? I mean, really, if there's people on there that's spewing out fear, then unfriend them for 30 days, Stop watching mainstream media, period, I mean, really filter in what you're taking in. And this is pretty common. Most of us are doing this anyway, but when you're looking at research, look at websites that are official. I like to start my morning day with gratitude. I can't stress this enough. Journal, say it out loud, say what you're grateful for. If you can generate the feeling state, the elevated feeling state, you can literally calm your nervous system down, which is a good thing. Pretty amazing. So gratitude, elevate, feeling state of just raising your frequency and your vibration, which will definitely boost your immune system. Okay, we do not want to go down the rabbit hole. I want you to be prepared, maybe more than some that, again, takes, some people like get away from the now, but I want you to get present. I want you to enjoy life as best you can. Maybe this is an opportunity to read the book or do the puzzle or pick up an instrument, learn a language that you've been wanting to. The best plan, I want you to have a plan and I want you to be prepared, but I don't want you to overthink it. Okay. I think it's important for me to share with you very specific dosages on supplements, give you some specific recommendations on herbs. But a couple more things is, I think it's important to improve the ether. Deposit into the universe, on the internet, good vibes. Tell someone you love them. In a world that is often filled with negative news and media and hype and craziness, be the difference. It does start with you. Start with yourself. I think you've heard that before. So again, we want to recalibrate. If we can deposit into the ethers, and this is my woo-woo part, maybe we can offset some of the panic out there. It's like, if whoever raises the most chi wins. All right, so let's talk about protecting the lung. Avoid smoke, avoid air pollution. Again, if you can get an air filter, if you can get one of those machines from Hyper Air, please do. Cleaning out the lungs, getting outside, taking some deep breaths. Vitamin C, okay, 1 gram 3 times a day. Vitamin A, 10,000 units a day. Vitamin D, 5,000 units. Zinc, 30 milligrams a day. Resveratrol, 1,000 milligrams daily. Okay, these are things, boom, right away you can do. I'm happy to direct message me. I'll give you some protocols if I'm speaking too fast, but I want to finish up. Herbal medicine. I am an herbalist. Throughout ages and traditional cultures, herbs have been bolstering the immune system. Under the guidance of a trained herbalist or clinician, you can be gifted amazing herbal remedies. So as with all ingested supplements and herbs, quality, dose, potential drug-herb interactions are important considerations. So it's really important to work with someone on this, even if it's not me, okay? So there are some general recommendations, absolutely. But again, if you want individualized care and specifics on herbs or formulas or milligrams, please. Astragalus, Jade Screen, Yuping Feng Song, they can boost immune system. Stamets 7, that stack is a great combination of mushrooms to boost the immune. Elderberry, Echinacea, those have amazing evidence to support the immune system. In fact, I like a lot of mushrooms. Chaga, lion's mane, reishi, again, Stamets stack is pretty profound. What are some antiviral herbs, I would say? Well, you can do garlic. Fresh crushed garlic is an effective antiviral for the mouth, the throat, the lungs. I love licorice. Oh my gosh, that can boost the immune. It's also antiviral. Elderberry. Everybody knows about elderberry. It's a fantastic preventative herb against viruses. You can take it daily. I love the elderberry syrup. It feels so good on the throat. So definitely recommend. You can get a 4-ounce bottle. And then one of the other things that I've done is oregano. Oregano has been pretty amazing. Peppermint oil. So I've been diffusing peppermint oil and oregano oil in my diffuser every day, all night. I've been using, you can use Thieves or On Guard or other companies for immune to cleanse the air. I prescribe nature on a daily basis. Okay, I just taught 2 outdoor fitness classes this morning. It's something so primal as stepping outdoors. It can be healing. What did Hippocrates say? Nature itself is the best physician. Let's remember that. Taoists, Chinese medicine is all based on nature informing us. Okay, so nature is obviously informing us. So all these actions are going to improve your immune system directly or indirectly, but an ounce of prevention is worth a pound of cure, and a strong immune system is the key to prevention. Okay, so that's my main thing is to prevent this more than anything. I know there's a last thing I was going to say. Acupuncture, amazing to boost the immune system. Hemp, oh my God, hemp can boost your endocannabinoid system, not just CBD, but also CBG. Many of you know that I have an online hemp store. I also have an online herb and supplement store. It's dropping shipped. People are getting this in 2 days. They're getting, zinc and selenium and mushrooms and, all these other things to their door. So if you want help with your immune system and supplements, please reach out, direct message me. And more than anything, I just bless you on your journey to health. And I know these times might feel tough as a lot of activities have been canceled and our day-to-day life has been altered. I'm trusting that we each do the right thing, that we will spend time wisely on the things that need our attention. And we got to do this together. So I thank you for taking the time to watch this. I realize it might be a little bit long. And if anything that I've said lands or resonates with you, then take it as medicine. And if not, then just take it with a grain of salt. So I'm only part of the wellness solution. As you know, what I believe is you know yourself better than anybody, and you know what to do. So be well, do good work, take good care, and blessings to all of us. Bye.